Hello and welcome to BBC World News. One country that appears to have succeeded with the coronavirus where others have failed is South Korea. It's managed to flatten the curve of new infections, and it's done so without China's draconian restrictions of movement and without a large-scale lockdown. The BBC's team in Seoul has gained exclusive access to one of the country's intensive care units dedicated to coronavirus treatments. Here's Laura Bicker.
In every war, a foot soldier needs their armour. This kit is crucial to keep staff safe. Is the air going through okay, she asks. Now, fully equipped, she can head into the intensive care unit. The 2-hour shift takes its toll. We saw this nurse emerge drenched in sweat after her turn. Seriously ill COVID-19 patients need a lot of care. They're on a steady drip of sedation, medication and fluids. Ventilators help supply their lungs with badly needed oxygen. The protective clothing helps keep staff safe, but it also hinders.
It's hard to hear, and your senses get dull. The hardest thing is communicating. It makes you feel more anxious because of it. There is fear here, but I'd like to just think of them as our patients. And when you think of it that way, it's not that scary.
All of the patients struggling to breathe in this ICU are over 65. They're one of a dwindling number of people who need critical care in the country. The benefits of flattening the curve mean there's even time to smile.
Those who come to the ICU are really bad cases, so it's hard to completely predict whether they will live or not. But when these tough cases get better, it's especially rewarding.
This is the key to saving lives, according to South Korean health officials, staying ahead of the virus by tracing potentially infected patients and testing them. But doctors are worried about a second wave of COVID-19 and say this country needs to be ready.
Can we respond as well as we did in the first wave? Will there be 5-10 times more patients? I do not know. We don't have immunity. So all country scientists should work together to develop a treatment and vaccine.
There's also a new threat from overseas. Thousands of arrivals from Europe and many from the US are now being tested to prevent a fresh outbreak. South Korea may be breathing a sigh of relief for now, but this crisis is far from over. Laura Bicker, BBC News, Seoul.
And we'll be looking in more detail at the success they've had in South Korea around testing, the speed and efficiency with how they've been doing that, coming up in the programme in a few minutes' time. So do stay with us for that. Well, as we've heard, the key to South Korea's success has been speed and an early push towards mass testing, rigorous contact tracing and mandatory quarantine for anyone near a carrier of the virus. The country has a population of 51 million and it manages to test more than 20,000 people each day. It's set up more than 600 testing sites nationwide. The Director General of the World Health Organization said he had a simple message for all countries: test, 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 saying that without it, it's like fighting a fire blindfolded. But not every country is hitting the same targets as South Korea. Here in the UK, there has been testing of 960 per million people. Italy has conducted 386 tests per million, and the United States just 314. Whereas South Korea's rate of testing has been 6,148. So you can see the massive difference there as well. But the fight to fight this pandemic is testing the answer. We're joined now by Anthony Costello, a professor of global health at UCL and former director of maternal and child health at WHO, and our South Korea correspondent, Julie Yoon, who joins us from Seoul. Julie, I want to start with you. Can you just explain in more detail how testing works in South Korea and why it's been such a success?
So South Korean government, from the day one when they had the first patient diagnosed, which is going back to the January, government officials met with representatives from several medical companies to urge them to immediately develop a test kit, promising emergency approval. And this goes back 2 months. This was happening in January. And now the country can produce up to 100,000 kits per day. So testing capacity from the day one has not been an issue in South Korea. I think that is a very foundational step that the government has taken from the very early on, intervening in controlling the virus spreading in South Korea.
Julie, is it really easy to get a test? Because we've seen pictures of drive-through testing. People can just come in their cars. If you have symptoms or you're worried, can you access a test quite easily?
So, many have reported that it is very easy to get tested in South Korea, but it's not like just because you're not feeling well, you're under the weather, you can just go in and get tested. There are certain steps that you have to take. They advise you to call the hotline number first to go over your symptoms. And they would ask you if you have been into a hotspot areas, whether that's in Korea or abroad. And they would go through these questions and advise you to either stay at home and see how you feel in the next 2 days, or come in and get tested. So in order to get free testing, these are the steps that you have to take. Or if you've been notified that you have been in close contact with the confirmed patients, then whether you have a symptom or not, you have to go get tested. So it's not like it's widely available that anyone can go in and get tested, but it is readily available, and you can just call in the hotline and you'll get the information that you need.
Anthony Costello, to you in Yorkshire, it is really impressive when you hear from Julie how they're managing in South Korea and the numbers of people they're managing to test. Can you tell us why it's so vital that testing increases in other countries and what can be accomplished by testing?
Well, it's because you've got to find the virus. WHO policy is, as you've outlined, that you mobilize your communities, you find suspected cases, you test them, you find all their contacts, you quarantine them, and then as a backup, you do social distancing. And the key element they always emphasize is speed. Set these systems up early. And the countries that have done well, China, of course, started badly because they didn't do this before the Wuhan explosion of cases, but subsequently they did in all their provinces. Korea has done an excellent job. But even in Europe, you've got emerging differences. So Germany has a much lower death rate. It is testing very widely. It's had a younger population, and it's got a better surge capacity with hospitals. But if you just look in Ireland, the Republic of Ireland has set up 41 mobile testing sites where people can go and get tested easily. They're doing 100,000 per week for 4.1 million. We're doing 35,000 a week for 67 million in the UK. So we do have to ask questions why we haven't managed to get this set up.
Do you know the answer to that, or what is your view?
Well, I wonder whether that it was an over-centralized system. I think you have to devolve power to your provinces. I mean, we've got lots of these machines to measure the virus, PCR machines across the country. We've got an excellent primary care service. We've got outbreak management teams in every local authority. So it's putting the three together. And I just wonder if either they didn't do it in the correct way, or whether the scientific advisory group felt that wasn't the best strategy.
And briefly, where are we at in terms of home testing? Because it seems to me that could be a game changer.
But you have to remember there are two different tests. One is to detect the virus, which you want to do in order to get control. The other is to test for immunity. And the tests that the British government say they want to roll out are the immunity tests. We first of all need to know that they work, because if they produce a lot of false positives, it may lull us into a false sense of security. And we don't know yet exactly how that will be scaled up. It will answer an important question, though. If there is a lot of immunity and a lot of people who without symptoms have developed immunity, although we won't know how long that immunity will last, it will tell us whether we can expect this whole epidemic to be over sooner rather than later.
Really interesting to have your thoughts, Anthony. Thanks for joining us. And Julie in Korea, thank you too.